What is palindromic rheumatism, an autoimmune disease? Imagine experiencing sudden, sharp pain in your joints that comes and goes like a palindrome, reading the same forward and backward. That's a good way to think about palindromic rheumatism. It is a rare autoimmune condition characterized by brief, recurrent episodes of joint inflammation. During these attacks, you might notice swelling, redness, stiffness, and pain in joints like the knees, wrists, or fingers. Each episode can last from just a few hours to a couple of days, and then the symptoms completely disappear, leaving your joints normal between attacks. Palindromic rheumatism is considered an autoimmune disease because the immune system mistakenly targets the joints, causing inflammation. It shares many features with rheumatoid arthritis, which is a more persistent autoimmune disorder. For example, people with palindromic rheumatism often have certain autoantibodies, such as anticyclic citrullinated peptide antibodies, that are also common in rheumatoid arthritis. Because of these similarities, many doctors see palindromic rheumatism as a possible early or temporary form of rheumatoid arthritis. Studies show that between 15 and 66% of people with palindromic rheumatism may eventually develop rheumatoid arthritis over time. The main difference between the two conditions is their pattern. Palindromic rheumatism has a relapsing remitting course, meaning symptoms come and go with symptom-free periods in between. In contrast, rheumatoid arthritis tends to cause ongoing joint inflammation and damage unless treated. Importantly, attacks in palindromic rheumatism do not lead to permanent joint damage or deformity, which is a key feature of rheumatoid arthritis. Typical signs of palindromic rheumatism include sudden joint pain, swelling, and redness that often affect the knees, wrists, and finger joints. These attacks are short-lived, usually lasting only a few hours or days, and then completely resolve. Different joints may be involved in different attacks, and there is no evidence of joint damage on X-ray scans. Diagnosis mainly relies on recognizing this pattern of recurrent, short episodes and ruling out other causes of arthritis. Blood tests may reveal autoantibodies similar to those seen in rheumatoid arthritis, but there are no specific tests that definitively diagnose palindromic rheumatism. The exact cause of palindromic rheumatism remains unknown. Researchers believe that genetic, hormonal, and environmental factors may play a role. It is thought to involve both autoimmune and autoinflammatory processes, which means the immune system is overactive or misdirected, leading to these episodic flare-ups. From the perspective of rheumatoid arthritis, palindromic rheumatism can be seen as a related condition that might precede or develop into rheumatoid arthritis in some individuals. Recognizing and monitoring palindromic rheumatism early can be important because it offers an opportunity to manage symptoms effectively and possibly delay progression to a more chronic form of rheumatoid arthritis. Treatment usually focuses on controlling inflammation during attacks. Non-steroidal anti-inflammatory drugs are commonly used to reduce pain and swelling. Corticosteroids may be prescribed for more severe episodes. If there are signs that the condition is progressing toward rheumatoid arthritis, doctors might consider disease-modifying antirheumatic drugs to help slow down joint damage. Regular medical follow-up is essential to monitor changes and adjust treatment as needed. In summary, palindromic rheumatism is an autoimmune disorder characterized by brief, recurring episodes of joint inflammation that do not cause lasting damage. It is closely linked to rheumatoid arthritis but differs in its intermittent pattern. Understanding this condition helps in early detection and management, which can improve quality of life. Always consult a healthcare professional for personalized advice and treatment options tailored to individual needs.